Hey everybody, it's Dr. Wellwood here at the end of the day at the Natural Health Center. I spent literally the entire day treating patients with injections at the Regenerative Medicine Institute. Many of you guys know that I have a dual license, and I do injections on one license and I do chiropractic on my other license. So I thought I'd talk a little bit today about a conversation that I had with a patient yesterday who I had seen once before last week sometime, and she came in and said, "Wow, I feel pretty dang good. I got about 25 to 30% relief." And she said, she asked me, "Well, how long is it going to take, and how many times do I need to be seen?" And for those of you who know me very well, you know that I'm a big believer in the treat and release. That means I want you guys to get out of here. I don't want you spending all your time at the doctor's office. I'm a big believer in function. So I will tell a person you need to get up and get moving and get out of here as soon as possible. But sometimes when a person comes in and they get relief after that first adjustment and they're feeling 80-90% better, they're good to go. I won't see you again until you actually have pain again. The other types of versions are people who have had chronic conditions or they've had a new injury. And sometimes those take a little bit. So when somebody asks me, "Well, how long is it going to take?" Well, when did you get injured? How much relief did you get off that first visit? Are you a smoker? Are you a drinker? Are you obese? Do you have a sit-down job? Do you have an over-aggressive job? Do you have 4 kids that are making you tired? Do you sleep well? See, all those things kind of interplay in there. So it was really actually fortuitous today because I subscribed to this physical medicine doctor newsletter, and in it, it actually had the new guidelines for how much a person can expect to be treated and how long they can expect to be treated depending on the condition that they have. So for those of you who are really interested into seeing exactly how long and when you should expect to actually feel good, this great article came out in the Journal of Manipulative and Physical Therapeutics. That's the journal for chiropractors, physical therapists, and medical doctors who do a lot of physical medicine treatments. And what it showed is basically if you have a new injury, such as you fell off your ATV, or if you fell off your horse, or you jerked your arm or something like that, then you're going to be seen for between 2 to 4 weeks and between 1 to 3 times for those 2 to 4 weeks. If you've had an older injury, such as a chronic recurrent lower back pain that just kind of never goes away, they're recommending an initial treatment plan of 1 to 3 times a week for 2 to 4 weeks. So it basically sounds like no matter what, if you have an old or a new injury, the most recent guidelines show us you're going to be seen between 2 to 4 weeks, 2 to 3 times per week, which goes really close to what we already treat or what we usually recommend. If I don't see you on an as-needed basis, or if you're not on a sustainment or maintenance plan of once a month, which about half of my patients are, then oftentimes we will see you for twice a week for 2 to 3 weeks. So it's nice to see that we're actually right in the most recent research. So this is a quick little blurb for you guys. Hope you're having a good night. I'm going to do a couple notes, and I will go home and have fun with my kids. I'll talk to you guys soon, and I will be open tomorrow, Wednesday, and Thursday. See you then.